The process starts when filtrates such as water, salt, hydrogen, glucose, and urea, along with plasma proteins, white blood cells, and red blood cells, go from the afferent arteriole into the glomerulus. From there, pressure allows the filtrate to go into the Bosman capsule and then into the proximal tubules, while the larger cells, like plasma protein and red and white blood cells, have to go through the afferent arteriole. From in the proximal tubules, the filtrate separates, and the active and salt, amino acids, and glucose are actively transported from the interstitial fluid into the petrotubule capillaries. Also, water, bicarbonate, and potassium are passively transported into the interstitial fluid and then into the petrotubules. Also, ammonium and hydrogen are made in the proximal tubulus to allow for the stabilization of the pH. From there, the filtrate goes into the loop of Henle, where it specifically goes into the descending loop, where water exits through the aquaporins, which allows for the increase of osmolarity. And then, when it goes through the ascending loop, the salt goes out, which causes a lowering in the osmolarity in the filtrate. Once that's done, it goes into the distal tubule, where ammonia and hydrogen are made to stabilize the pH, and drugs and toxins are secreted, which contain water, aldosterone, urea, and renin. If there's a high osmolarity, then ADH is released, which allows for the increased absorption of water, and when there's a low blood pressure, then the RAS hormones are released, which allows for the angiostensin and renin to be released, which causes water and sodium to be reabsorbed.